Hi, guys. To those who don't know me, my name is Desiree Hornung. I'm the nurse here at Eisenhower. A lot of the students, I tell them to just call me Mrs. H because it's a lot easier. But anyway, I'm here with a lot of fun facts and a little presentation on infection control and my health office protocol and other little tips that we're working on. So, first, I just wanted to say if you have any questions or concerns, you're always able to come and talk to me confidentially. If you have your own medical concerns and you'd like to fill out a staff emergency medical card, you can come grab one from me and we can talk about it. I can keep it on file confidentially in my office. Normally, after this meeting, we do our EpiPen training for my delegates. I think this year, since we have a lot to cover, I'm going to send out slides on the EpiPen training. And then when you've completed reviewing them, just come and see me. You can do the demonstration with the trainer and the training device, and I'll just sign you off on that. You may have, we have a couple of people that are doing glucagon training on the 2nd at the high school. Glucagon is an emergency medication for diabetics. We do have a diabetic 7th grader this year, and it's a medication for when like snacks and a juice do not do enough to raise the blood sugar. So a few of you will be attending that. And then there is the Narcan training that will be virtual on Friday the 4th from 11 to 12:30. And generally our coaches, club advisors attend that. We have to have stocked Narcan in the building. It is an emergency nasal spray to reverse any kind of opioid overdose. I'm always recruiting members for my MERT team. That's our Medical Emergency Response Team at Eisenhower. Please let me know if you served on this committee the last few years and you'd like to continue. Thank you. And if you're new and interested, you just have to be CPR certified, and it has to be current. We do have usually 2 drills a year with the medical response team, just responding to a medical emergency and using a trainer AED device. Yearly health awareness lists. So I will have health awareness lists printed for 7th and 8th grade. So you can come and see me for the list and we can review it, and any questions you have, I will be more than happy to go over with you, and then you'll just sign off that you reviewed the health awareness list by September 20th. Lastly, I wanted to just refer you to EMS Important Docs, the health office folder. Last year, I created a document called Medical Education for Staff. So it's a resource with any of our common medical conditions, such as asthma, anaphylactic allergies, diabetes, things like that. And I also added a COVID-19 toolkit. So there's a lot of resources there regarding our protocols and just educational resources for you as well. So I'm going to go ahead with our presentation on infection prevention and COVID-19 protocols. And I have a lot of resources for you guys. Like I said, in that help office folder and EMS Important Docs has a COVID-19 toolkit, which has a lot of great resources as well. So just the highlights on COVID-19. I know you guys know probably more than you'd like to know about this by now, but it's also known as SARS-CoV-2. It is a new virus, essentially affecting the respiratory tract. Anyone can be infected. Most cases are mild, but there can be severe or even fatal cases, and we're still learning about it. How it's spread. It is spread through droplets when we talk, cough, or sneeze, and people can become infected when these droplets enter the eyes, nose, or mouth. So it's really important to keep your hands away from your face. I know that's easier said than done. Touching contaminated objects or surfaces puts the droplets onto your hand, and then if you touch your face, the droplets can enter through your eyes, nose, or mouth. So 6 W's for returning to school or work during a pandemic include wearing a mask, washing your hands, watching your distance. When sick, stay home. When the health department calls, please answer the phone. That aids in the contact tracing efforts. And then windows and doors should be kept open for airflow. So infection control or prevention, it is done to stop the spread of infection, and it protects individuals from becoming infected. Standard precautions are used for all because often we don't know who has COVID-19, and often people who have it are asymptomatic, so they don't have any symptoms that are obvious. So it includes hand hygiene and use of appropriate personal protective equipment, PPE, and examples include face masks, eye protection, gowns, gloves, which are all indicated by the risk level. So we're all wearing face coverings. Strategies that can be implemented include health questionnaires, avoiding exposure, wearing that face covering, and social distancing. Other control measures include the hand sanitizing stations, limiting points of entry, cohorting, limiting group sizes, virtual as needed. Education, we tried to put up lots of signage and floor markings, and then isolating those who are ill. So hand hygiene, it's just another term for cleaning one's hands in a way that reduces potential pathogens, and it includes the alcohol-based hand rub or washing with soap and water. And then there's links here with posters and demos that you could take a look at. So according to the New Jersey Department of Health guidelines for schools, hand hygiene should take place upon arrival at school, before and after meals and snacks, after going to the bathroom, before leaving for the day, after blowing your nose, sneezing, or coughing, or when your hands are visibly soiled. And we know that some of our students will need some reminders about that. Face coverings. So the CDC recommends them in public and when we're around people who don't live in our households, especially when other social distancing measures are difficult to maintain. But we know that the risk level for transmitting it is a lot less if everyone is wearing a face covering at all times. Some important points are to remember to hand sanitize, clean your hands before you put that mask on, and then after you remove it. If you do have to remove it, you want to fold it in half so that the inside of it is not exposed, and you're placing it on a clean paper towel. Making sure that your nose is always covered, not just your mouth. Do not touch the front of your mask. You want to remove the mask by touching only the ear loops or ties. And you want to make sure that you're not wearing any of those face masks that have the valves, because although they're more comfortable for the user because you're able to exhale into, outside of your mask, puts others at risk. So we don't want to use any of those. And there's a good video on how to apply a face mask here. Some more do's and don'ts. Respiratory etiquette, that's just covering your nose and your mouth when you sneeze or cough. You want to use a tissue or a sleeve to cover up, and then always follow with some hand sanitizer or washing your hands. So staying home when sick, according to the New Jersey Department of Health, students and staff should stay home if they have tested positive for COVID, if you have COVID-like symptoms or potential exposure to it, if you've had recent close contact with a person with COVID in the past 14 days. Now, when we talk about being a close contact, in New Jersey, that is considered being within 6 feet of someone for at least 10 minutes. And then if you're traveling to an area with high levels of COVID within the past 14 days, you want to take that into consideration before you travel. We have the New Jersey travel advisory list if you're traveling out of state. That's always changing. And then the international travel advisory list, which the CDC updates for out of the country. So our exclusion guidance flowchart that we're using is based on the New Jersey Department of Health and CDC guidelines. We are collaborating with the local health department. Our school physician has reviewed everything and supports it. And I'm going to open that up for you so you can take a look at it. But you also have access to this in the COVID-19 toolkit. And it just kind of tells you how to proceed in several different scenarios. So the green is generally good. Yellow, you're using caution. The red is a stop. So let's look at that one there. If you have a positive diagnosis, whether it is with or without symptoms, you want to proceed accordingly. So can't go to school or work. It has to be 10 days since the start of your symptoms or 10 days since the positive COVID-19 test if you've had no symptoms. And then once those 10 days pass, you must, have improving symptoms and 24 hours fever free without that fever reducing medication. So if the 10 days pass and you're still feeling really lousy, you still cannot come back. So it's 10 days with those improving symptoms and fever free. And the lengthy list of symptoms there. And basically, we are going with at least 2 of the following symptoms from one group or 1 of the following symptoms from the other group. And this is based on the New Jersey Department of Health guidelines, and our normal school protocol is taken into consideration as well. So for instance, if you have a fever, you're home. If you have a new onset cough or any issues with your breathing, vomiting, diarrhea, just one of those would keep you home. But then all those other symptoms, the sore throat, the nausea, the aches, you need to have 2 from that column that you'll want to stay home for. And again, this is based on the guidance from the New Jersey Department of Health, and our school doctor has also reviewed this as well. And understand that since COVID impacts certain areas of the state differently, the New Jersey Department of Health will be posting online weekly the transmission levels based on each region, and they'll characterize it as low, moderate, high, very high. So the local health department should use that risk matrix when they're providing guidance for our schools as far as what actions that we should take based on the level of COVID-19 in our community. So your daily routine before work, you're going to be monitoring your temperature and monitoring yourself for symptoms. If you're unable to attest to wellness or you have a temperature of 100 degrees or greater, you need to stay home. Stay away from other people, contact your healthcare provider. If you are well to go to work, you're going to proceed, wear your face covering, wash your hands upon arrival to school and often throughout the day. You're going to practice social distancing, avoid being a close contact of anyone. So you just don't want to be within that 6 feet of someone for 10 minutes or longer. Avoid congregating in common areas such as the mailroom, the office, or when making copies or eating. Um, Remember to bring your own water bottle, probably something that you can close so nothing can get in there. And then taking it home every day, make sure you scrub it. So if you begin to feel ill while you're at work, you don't have to come and hang out in the isolation room with me, but you should definitely go home immediately if you're exhibiting any of those COVID-19 like symptoms and consult with your healthcare provider. And there's that long list again of those symptoms. So, something that I wanted to talk about were our health office visits, sending kids down to me. Protocol is a little bit different this year. So, in order to minimize the possible exposure of a healthy person, please use the following guidelines for sending students to the health office. I will go over the little flow chart there, and that is also in the COVID-19 toolkit in EMS important docs under health office. But the main thing is please always call the health office prior to sending a student. Um, for, for one, I need to make sure that I can safely space them apart. So if I already have two kids in there, I, really can't fit another one. So I need to make sure that I can distance them, but I also need to know how to prepare for the visit. And if it entails a possible isolation, like if you think a kid like looks, visibly ill, they're peaked, they, can't keep their head up, something along those lines, I'd need to have a heads up so I know that they're going into the isolation room. And when at all possible, encourage students to use mindfulness and relaxation techniques to control anxiety, which is often manifested by those symptoms that we see so often, such as headaches and stomach aches. So I'm just going to pull up our health office protocol. I know it's a little bit small. I'm sorry. But when sending to the school nurse, so is the incident classroom or health office managed? So I am going to ask that everyone keeps a Band-Aid baggie in their classroom. I'll have those ready for you guys. And if it's a minor cut with minimal bleeding or a paper cut, or these guys that just pick the skin off their fingers, they can wash their hands or hand sanitize and then put the bandage on themselves, and proceed, with the lesson that you guys are working on. Stomach discomfort, I have them use their bathroom. I do not have a bathroom for kids to just use at will currently. So encourage them to go use the other bathroom, have a drink of water. Something like bug bites even, they can apply a cold, wet paper towel. We're highly encouraging students to carry their own medications when possible, like their inhalers and EpiPens, like a lot of them already do. But the more they can carry and not have to actually come down to the health office, the better. Obviously, if they're unable to perform self-care, if the cut, or scab comes off and it's in an awkward spot and they can't, manage to bandage themselves up, that would warrant a call to me. And if no one's in my office, I might opt to come down to your classroom, at the door with a procedure cart that I have developed, just a small cart with first aid and items in it. So I have some flexibility as to where I can, bandage someone up, or even bring you an ice pack, bring the student an ice pack. So if the incident cannot be managed in the class and you think that the student looks, ill, or any other, matter, obviously you're calling me, still calling prior to sending the student just for a directive. And face coverings are always required. They'll be wearing them in class anyway. But, I would let you know, if you could send the student down. In most cases, if it's somebody that you think looks really sick, though, I'll be opting to just come down, get the student so that I can assess, which room, the well room or the isolation room, that I'll be putting them into. So when in doubt, just call me. If it's not an emergency, I might tell you they have to wait. I'll call you and let you know once somebody else leaves. But obviously, if it's somebody that you feel looks ill, we'll get down to you ASAP. And if the student is sick, they're going into that isolation room, which is right next door to me, close in proximity. Those students have their own bathroom in what was my my normal office, and they'll remain there until picked up by the parent, and they'll go out the closest exit to that room there. um, well room. So students that I'm seeing in the well room would be for, sometimes a first aid that needs to be performed, or an injury assessment, or a student that receives medication or has other healthcare needs, such as diabetes. So is um, that chart is also in your COVID-19 toolkit. So you will be provided with Band-Aids for your class. Students are encouraged to perform self-care. And like I said, if they're having difficulty, there are times where the nurse might come down to the classroom with a procedure cart to quickly provide the first aid, enabling the student to remain in class. And the isolation room is just what we're calling that sick room or health monitoring room, where students will await pickup to go home if displaying COVID-like symptoms. Health office visits. So just so you know, the criteria for sick students, similar to the assessment that you'd be doing on yourself before coming to work. After a visual and verbal assessment, students will be instructed to wait in the isolation room and be sent home based on the following. So if they have at least one of the following symptoms from the first column, or at least two of the following COVID-like symptoms from the second column, or if they say that a member of the household had COVID-19, that kind of thing. So coping with COVID-19 stressors, we know it can be really stressful. The effects can be both physical and emotional. So things you can do to reduce stress. Certainly, I find taking a break from social media and the news helps. Engaging in activities that you enjoy, eating healthy, exercise, walks, practice your mindfulness, and just know if the stress is interfering with your daily life or your anxiety is escalating. You want to talk to your doctor or someone that you trust. I have a lot of resource links here. The first one, the New Jersey Department of Health, were the guidelines for schools that we got like August 13th. But it's very detailed and very easy to understand and helpful, along with other resources that I find to be really easy to follow and useful. And I think that's it. So if you have any questions, I believe we're going to have a Q&A. I know it's a lot of information. As things pop up, just feel free to always ask. And I really appreciate all of your guys' support and being able to help. And I appreciate all of your flexibility. I know that a lot of this is new. So thank you so much. And here's to a good school year.